Hi, good afternoon. Thank you very much for the invitation, and I am sorry that I cannot be in Prague. I am Aniko, Varadi professor in biomedical research, and I'm going to talk about a project which was done in a collaboration with many partners. You can see it on the slide here. But before I talk about the project, what we have done, I would like to give you a little bit of background on the Genomic Medicine Service in the National Health Service in England. So in 2012, David Cameron, the Prime Minister at the time, launched the 100,000 Genomes Project. And the aim of this 100,000 Genomes Project was, as it's in the name, to sequence 100,000 genomes. And this project led in 2018 in the establishment of the National Health Service, or NHS, Genomic Medicine Service, or GMS. So what this actually means? So within the GMS, we have 7 Genomic Medicine Service Alliances, what you can see in colors here on the right-hand side. The genomics laboratory hubs, which are all aligned to the Genomic Medicine Service Alliances, and 17 clinical genomics units. And the aim of this project is to deliver the genomic service for the entire population of England. There have been several different policies published since 2019, which are listed on the top left side. So the ambition is there because currently, if you look at in 2024, we are carrying out about 800,000 genomic tests, and these tests are going to be more than doubled by 28 within the next less than 4 years. And this slide is actually from Professor Dame Suhill, who is the Chief Scientific Officer for genomics in the NHS. So the task is enormous. And if you consider that in England we have 300 trained genetic counselors, the question is really there, who is going to talk to the patient and how this service is going to be delivered? Are we ready for that? So the model is that the clinical genetic service will be very different, and the genomic testing is incorporated into the patient's routine clinical care, and this will be managed by many of you who are listening, so by nurses, midwives, and allied health professionals. And it's very clear within the NHS, but I am sure that this is going to apply in many other countries, that upskilling of this workforce, this non-specialist clinical workforce in genomics, is absolutely crucial. We have 2 recent policies, what I can show you here, and you can read about it a little bit in more depth if you wish. So currently in the NHS, we have about 700,000 professionally qualified clinical staff, and more than half of them are nurses and health visitors, and you can see that about less than 10 compared to nurses, midwives. But these are the clinical staff who are the most patient-facing, and very likely that they are going to deliver or inform the patients about the genomic tests. And we wanted to see that how these professionals are actually qualified to do this job, because in England, many of them don't have much science background. They never learned about genomics, so they don't really have the information. So how are they going to deliver this to patients? So we done one analysis. We looked at what proportion of nurses and midwives have been formally educated in genomics as part of the MSc in Genomic Medicine program, which is one major program within NHS England. And if you look at first these brown bars, these are the number of professionals who have been taken up at least one 15-credit module at level 7, which is a master's level program. And you can see that there were quite a number of healthcare scientists, quite a number of medical and dental professionals, but nurses and midwives, less than 1,000. And if you normalize it to the numbers that I have shown you, the size of the workforce, then this should be 7-10-fold higher for nurses and midwives. So clearly, they don't seem to be involved in any of the training. So our objective was to actually, or the aim was to identify how nurses and midwives are trained in genomics and what their training needs are, and to also identify what is the suitable delivery for that training. You can see many of the objectives. I don't want to list all of them, but one of our objectives was to actually work out a genomic competency, a simple competency framework, identify the gap in their knowledge, develop based on that information a standalone postgraduate module, then develop it into either a master's or other postgraduate courses, and every single step of the way assess the impact of this training to patient and services, because ultimately you want to have a course which is impactful. So what did we do? Initially, we looked at what competencies nurses, midwives would need. And we ran a literature search, a very extensive literature search, but of course, not many papers were out on competencies for mainstreaming, but nevertheless, you can apply more or less the same principle what you would use even if this wouldn't be the main job of these professionals. Then, when we identified these competencies, we contacted several lead nurses, several stakeholders you have seen as our collaborators, and we tested all these competencies, and those which were scored above 8 out of 10 were included in our competency list. And then we actually used that list, or used these competencies to test the knowledge and to see where the workforce is. So this is our 13 or 13 plus 1 competencies, and I don't want to go through every single one of them. This has been published, we published it last year, so you can find it in Frontiers in Genetics. So we came up with these very simple 13 competencies for the workforce, and then what we wanted to see that where are the gaps? Do we have gaps in these key competencies? And we asked several different cohorts of nurses, midwives. I work at a university, so I have access to many of them. So we asked them how confident or knowledgeable they felt around those 13 points what I just shown you. And then we also asked how important they think that these are for their practice. And we done these surveys between 2018 and 24, so within a 6-year period. So it's quite a long time. And what I expected that because we had the 100,000 Genomes project, we had the genomics, new genomic medicine service, that you would see a change in their confidence or knowledge because it's all over the place where they work. And what you can see, this is like a 6-year period, that actually there was no significant change over that period. So they felt that their confidence and knowledge level was low. 1 was that I am not confident and knowledgeable at all, and 5 is that I am very confident, I understand everything around the topic. And so this all showed that basically whatever we have been doing in terms of genomic training and education is not terribly effective. But when you ask about how important they felt it was, if anything, it went up. There was a significant upward trend, with the exception of this one group where they randomly got the survey, and surprisingly, these nurses are actually doing prescribing, and they are not aware that pharmacogenomics is actually relevant for their work. So what you can see is that there is a big gap in terms of knowledge and confidence. And I also looked at that we have just-in-time and just-in-case education model. So basically, you use a video, you go home after a long day work, put on a video, do a few short videos, and this way you educate yourself in genomics. I don't think that this is actually realistic because I am a biomedical scientist. I have been trained in genomics for probably 20 years. So I really don't think that a 20 minutes video is going to help you in terms of delivering confidently a genomic service. But we needed evidence for that. So one of my students who actually done a genomic course with us, she looked at within her own trust the nurses, the non-genomic specialist clinical nurses. She asked them to fill in a survey. And she asked the question that, okay, how much do you know about the NHS genomic education program? They have lots of videos. This is our go-to place if you want to know something about genomics. Or the Genomics 101, which is a video recorded session. And what you can see that less than 5% actually occasionally used any of them. The rest, either they don't know about it or they heard about it, but they never used it. So this means that whatever we put or invested into, it's not effective because those who are targeted by these courses, they don't know about it. Then we also asked the question that what preferences do you have in terms of education? What would you like to have? And overwhelmingly, it was either in person or online blended. So something like this, what we are doing at the moment, but we have an instructor present, and that instructor occasionally interact with them and can answer questions. When you look at how effective online video is actually at the bottom. And that's the main drive how we try to educate the workforce. Then we also ask not just a survey, but we also ask questions from this. This was some of the nurses who actually signed up for our course. And we asked them that where they are, how do they feel? And which was the most striking for me, and that really has driven me to put together a course which is very useful, it was that they have lack of knowledge, they feel nervous, uncomfortable in this rapidly changing world, and they don't want to talk to patients because they don't know the answers. So we thought that we have this new genomic medicine service, so why don't we put together a 15-credit postgraduate course, just one single module, which runs from September until February with lots of breaks, and this can be done part-time. It runs online, but it's instructor-led. And every part of the genomic medicine service, what I have shown you on the previous slide, are incorporated. So they know about the labs, they know about the Genomic Medicine Service Alliance. Part of the GMS is now the National Genomic Test Directory, so it outlines which test can be done or should be done. So we incorporated all these into the module, and this is how the module looks like. And as you would expect, we have some standard modules what you would have in any course. The one which is very different, that we really wanted our learners to have a personal development as part of their course, so they see how genomics fit into their career and their practice. And we assess them in a way that it is really practical for them, so they can choose the assessment what is relevant for them. But we co-educated nurses, midwives, those who are specialists in cardiac conditions, cancer, everyone on the same course. And then what we did was we had several different cohorts, and we done a survey before they started the course, afterwards, and 12 months later. And this is the data what I have shown you about the importance. How important did they feel before and after genomics is for their profession. And luckily, these are 3 cohorts who just finished. We have the 4th cohort data. They only finished a few weeks ago, so I cannot show you that data. But what you can see is that, if anything, importance increased. So we didn't really put them off genomics, which is, I think, is fantastic. But where we have seen a huge difference is actually in terms of knowledge and confidence. So as you remember, at the baseline, it was around 2. and after finishing the course, it went above 4, so they feel much more confident. And this is the breakdown by the 13 different competency questions. And some of the comments were that it doesn't scare me now, it's so interesting, I want to know more. And this I want to know more led to a new course. So basically, this is how we started. And then we developed a PG cert in genomics, and we have 2 additional modules. And this can actually lead into a professional development award, which can build into a master's. And I would like to give you a few examples that this actually works. So these are our students, Denise, Angela, and Vahida. All of them are midwives. And before they started the course, obviously they did some of the genomics, but very little. They all changed their jobs after finishing the first module. All of them are related to genomics. And then they started on the PG cert. And I would like to show you Angela's project, what she just finished. So we just awarded the PG cert to her. What she did was she done 3 recorded videos for those pregnant women who need invasive prenatal testing. And in these videos explained what's going to happen, what are they testing for, and then she asked her colleagues, the patient, how did they feel using these videos. And the staff, they felt that it was very useful for the patient. The patient felt much more informed. And when they looked at the consenting time, that's actually reduced by 30%. So in a stretched healthcare, it's very important that we can deliver something which is reducing the time what is needed for delivering the service. Our next case is Liz Lawrence. Liz actually never done anything genomics, and she started after the first module, finishing the first module. She was appointed as a Lynch champion in her trust, and because she was looking after many of the patients with suspected Lynch syndrome, she was the person who was leading this service in her trust. And just would like to give you the key findings that actually all those who would have been missed, about 30% would have been missed, were included in the testing, and also the waiting time for some of the pathology result reduced significantly. And now she has been appointed as a lead genomic practitioner, and she just started in her new job. And the final example I would like to show you is Siobhan. And Siobhan, like Liz, was appointed as a Lynch nurse facilitator after finishing the first module. And now she is actually running the generation study as a genomic practitioner in the Southwest. And she is actually leading some of the projects. And the fantastic thing what she was done was that she used our competency framework, translated into a working document where you can easily check the knowledge competency of your colleagues in various different pathways, for example, in Lynch syndrome. So basically now she published this paper, and our competency framework is used within the NHS as an active document. This is just a summary slide for you to show what effect this postgraduate course actually had. We made lots and lots of changes in the last 4 years, and I am very proud that many of my past students, they are still working in the NHS and very keen about genomics. And what would I recommend for long term? I think it's very important that we have very clear competency frameworks which are evidence-based, so either published as a peer-reviewed papers and involve lots of professionals contributing to it. I think it's very important that we invest into the upskilling of the non-genomic specialist workforce. I think the taught courses have really good place even in this technology-driven era, because many of the nurses, many of the workforce don't have the knowledge. And I think it's important that we obtain quality badges, like, for example, the Royal College of Nursing accreditation. Thank you all very much for your attention, and I hope you have a lovely time in Prague. Thank you. Bye.